Here is an example of one warm-up you can do before practice or competition, and it should only take 15 to 20 minutes. If you would like to see other examples of exercises or full exercise programs, please visit our YouTube channel, Adapted Sports Injury Prevention. And if you experience any pain during any of these exercises, we advise you to stop. Each exercise can be modified based on each person's limitations or needs. The first set of exercises are 2 mobility exercises. Mobility is extremely important in wheelchair tennis in order to prevent injuries and give you maximum power behind your swings. The first exercise is a pec stretch. In order to stretch these muscles, you're going to position your chair next to a fence or pole. You will place your arm and elbow in a 90-90 position and rotate in and away from your arm to make the stretch more dynamic. Dynamic stretches are good to do before practice or a game. We will perform this stretch for a minute each side with 3 to 5 second holds. Next up, we have the open book and rainbow exercise. This exercise is meant to work on the mobility of your spine as well as your shoulder joint. Getting good rotation through your thoracic spine is important and helps take away some of the stress that may be placed on your shoulder while playing tennis. For the rainbow, you're going to position your chair parallel to the fence or net. Extend both arms in front of you. Lift your arm closest to the fence up in the motion of a rainbow as your chest rotates towards the fence. For the open book portion, your arm closest to the net is extended, and your opposite arm opens up as you rotate your trunk away from the net. You will complete 10 repetitions of each exercise, and then repeat facing the other direction. In today's workout, there are 3 strengthening exercises. Unless otherwise noted, each exercise is done for 2 sets of 8 to 12 repetitions. If you have difficulty stabilizing yourself during any of the following exercises due to a lack of core activation, you can complete the exercise one arm at a time while placing your other hand on the chair to help stabilize yourself. You should perform all of these strengthening exercises at an RPE between 12 to 15. If the athlete identifies the intensity of the exercise below a 12 on the RPE scale, the exercise should be progressed to something more difficult. If the athlete identifies the exercise as above a 15, then the exercise should be regressed. The first strengthening exercise is a pull-apart series. This exercise has 3 components. First, you'll hold the TheraBand at shoulder level with palms facing down. Pull the band apart as you bring your arms out toward the side. Do this for 10 repetitions. Then, flip your palms so that they are facing upward and do 10 more repetitions. Finish with your elbows at your side and bent to 90 degrees, palms facing up. Keeping the elbow at the side, pull the TheraBand apart. Again, this is done for 10 repetitions. Adjusting how close or far you are holding the band will increase or decrease the resistance, respectively. For an even greater change to the intensity of the exercise, change the color of the band being used to make it easier or harder as appropriate. The second strengthening exercise is an overhead W pull-apart. This is a bilateral exercise and requires a TheraBand. The TheraBand should be held by the athlete in both hands. The athlete's arm should be placed in an overhead position, shoulder width apart. The athlete then separates or pulls apart the band while bending their elbows down towards the ribs, making a W shape and bringing the band behind their head. The athlete should ensure to keep tension on the band throughout the motion and focus on squeezing the shoulder blades together to avoid excessive upper trap activation or shrugging of the shoulders, as this is not the muscle we are trying to target with this exercise. To progress this exercise, it can be performed at a slower tempo, for more reps, or at an increased resistance. To regress, resistance can be decreased or the exercise can be performed unilaterally. The final strengthening exercise is the Pallof press. To set up this exercise, the wheelchair will be facing forward and will be locked, or if in a sport chair, blocked from moving. A band is attached at or just below shoulder level to the side of the athlete. The Pallof press is performed by grabbing the band with both hands and pulling the band to the center of the chest. While keeping the band in line with the chest, extend your shoulders and elbows out in front of you. The band is pulling the arms and trunk towards its attachment, and the goal of this exercise is to resist the rotation and maintain facing forward while keeping the arms at midline. Similar to previous exercises, this exercise can be made more or less difficult by changing how close to the attachment you are holding the band or by changing the color of the band. Additionally, This exercise can be progressed by incorporating a rotation away from the anchor point. As an alternative, if lack of core activation is an issue, the athlete can try drawing circles or the ABCs while maintaining the pressed position. The next exercise focuses on dynamic stabilization. This exercise will help activate muscles that stabilize the shoulder girdle and makes a great warm-up before beginning more intense strengthening exercises or sport-specific play. This exercise is performed for 1 minute per arm. This can be progressed by increasing the time of the exercise or by using a heavier ball, although it will still need to bounce. The exercise can be regressed by decreasing the time or using something lighter like an inflatable beach ball. This exercise should fall between a 12 to 15 on the RPE scale. If the athlete identifies the exercise below a 12, then it is too easy and should be progressed. If they identify it as above a 15, then it is too difficult and should be regressed. This exercise is in what we call the 90-90 position. The shoulder is raised to 90 degrees of abduction, meaning out away from the body, and the elbow is bent to 90 degrees of flexion. The shoulder is externally rotated so that the palm is facing forward. The wheelchair will be positioned facing the fence and may require assistance from a friend or coach or a block to prevent backwards rolling of the chair. The chair should be as close to the fence as possible to allow proper positioning of the arm. The ball is then going to be bounced against a wall or fence for 1 minute. It is a continuous rhythmic motion. The motion should be driven from the shoulder, not the wrist. This position is great for tennis athletes because it mimics the position of an overhead hit or serve. If you do not have a ball available to use for this exercise, it can also be done using a TheraBand. To set this up, position the wheelchair facing away from the fence and attach the TheraBand slightly above shoulder level. Grip the TheraBand and position the arm in the 90-90 position. Make sure the wheelchair is far enough away so that there is adequate tension in the TheraBand. Work in a small range of motion to activate scapular stabilizers just as you would with a stability ball. If the athlete has difficulty gripping the band or has limited grip strength, you can tie a loop at the end of the band or put it around their wrist. The final set of exercises are sport-specific drills that you can perform before you start playing on the court. Incorporating sport-specific drills is a great way to prepare your body for the demands on the tennis court, such as wheelchair mobility and agility and proper wheelchair propulsion mechanics. Replicating the demands of wheelchair tennis play during warm-ups can help decrease the risk of injury. The first drill is called the fan drill. You will need 6 cones set up in a half circle configuration with 1 cone at the center and 5 cones surrounding it with equal spacing in between the 5 cones. The 5 cones should be about 5 to 6 feet away from the center cone. However, the spacing can be altered in order for the athlete's wheelchair to fit in between each cone. Once the cones are set up, the athlete will be instructed to maneuver around the cones in a figure 8 pattern in the direction from the left to right cones of the fan, always returning to the center cone. This is then repeated in the opposite direction, doing figure 8s around the cones of the fan, right to left, always returning to the center cone. Next drill is called 12 to 9 court pushes. This drill promotes proper wheelchair propulsion mechanics while gradually getting the body ready for the explosive wheelchair pushes. The athletes should place their hands at the 12 o'clock position on the chair and move from the 12 to 9 o'clock positions during propulsion. The athlete is instructed to propel forward at 25%, 50%, 75%, and then finally 100% of their max speed along the length of the court. The athlete should start pushing forward at 25% effort down the long end of the court. When the athlete reaches the end of the court, the athlete turns around and then proceeds to pull backwards along the short end of the court for active recovery. When going backwards, the athlete's hands should be moving from the 9 to 12 o'clock positions on their wheels. Next, the athlete should push forwards down the opposite side of the court, pushing at their next higher percentage, in this case 50%. This will repeat until the athlete is pushing at 100% effort.